So the Ebola outbreak, I'm going to start with that as usual. Some new work from Bloomberg talking about the fact that this, like all outbreaks, epidemics, has cascading impacts. It's expected to hit the GDP of the DRC. It's expected to drive more people below the poverty line. That's not surprising. That's what infectious diseases do. They are synergistic. They feed on this type of environment. The first clinical trial patient has been enrolled. This is a clinical trial looking at remdesivir, the antiviral, as well as a monoclonal antibody from MAP Biopharmaceuticals. It may take some time before we get any kind of readout, but it's really important that this clinical trial is starting so that we can see how well these countermeasures work against this species of Ebola. It continues to be violence in the outbreak zone. In Ituri, the mainly affected province, or the province that's got the most cases, 2 people died when an Ebola treatment unit was attacked. So this again speaks to the violence there, the kind of failed state nature of these provinces where this outbreak is present, and the fact that this is going to take some time before any kind of control is achieved. The Marburg outbreak, or the cases in Uganda, still a little bit nebulous. We have some information that at least one of the cases, there's supposed to be 2 cases, but I think only one officially reported, is a 1.5-year-old child. That tells me that probably 1.5 is pretty young. That means they got it from somebody else. It's unlikely that a 1.5-year-old was hunting bushmeat, for example. So I expect that the case count is higher than 1 or 2. Some other news about the pandemic office in the White House. Bloomberg is also reporting that they are starting to staff it up. A few people, a Dr. Brenner and a doctor, both of whom are HHS employees who have experience dealing with infectious disease emergencies, are being put into that pandemic office. One of the things I worry about is how they deal with all the politics in the White House. If you have policies like the irrational hantavirus armed guard policy, or remain in Africa policy for Ebola affected Americans, or the stand up of that Kenyan facility, how do you go along with that without sanctioning it? How effective can you be in that type of an atmosphere? And I think that's something that they have to ask themselves, and we'll see. I think it's important that there is a pandemic office in the White House. It's just that some of the other characters and other policy initiatives are going to clash with what's best for managing a pandemic office. Some stuff on measles. There was an article I read about talking to vaccine hesitant individuals, and one of the things they talked about is a technique called motivational interviewing. It comes from the psychology literature. It involves asking open-ended questions, trying to really get at why people are hesitant, what's driving that. And it seems to work in those people who are kind of in the middle, who are not going to be completely anti every vaccine just as a reflex, but those who have legitimate questions. The measles outbreak in Bangladesh continues to be very, very hard to deal with. This is a place that had 125 cases in 2025, now over 100,000 cases in Bangladesh. Did the virus change there? No. This was an administrative foul up with an interim government, which led to a force field going down. That force field is the vaccine. And then you get this outbreak. This is an important lesson. Bangladesh has a much, much worse than North America, but it's the same principle. Force field down, measles will take advantage of that. And speaking of Bangladesh, not only do they have to deal with measles, they have over 5,000 dengue cases. Again, GMO mosquitoes, Wolbachia infected mosquitoes. That's how we take dengue off the table and master the issue, is by using 21st century technological solutions. COVID. The emergency use authorizations are being wound down, and these were regulatory pathways that allowed medications, diagnostics, vaccines to be used without full FDA approval. Right now, in 2026, it's not very relevant, except for one antiviral, molnupiravir. This is a drug that's made by Merck that is an antiviral. It's actually going to also be tried in the Ebola outbreak. At least I've read something of that. This is one where if someone has a lot of drug-drug interactions and can't use Paxlovid, molnupiravir makes sense. It's kind of been always an alternative there, but it's good in its own right. We'll have to see what happens with this drug because it's not fully FDA approved and it's only available through emergency use authorization. Some other COVID stories: metformin, which is a diabetic drug, which is kind of a wonder drug that people are using for a lot of things because of anti-aging properties and anti-inflammatory properties. Seems like treating people with COVID along with metformin. When they get metformin, you give them the antiviral if they qualify, but you give them metformin, decreases their chances of severe disease. And also, there's a signal that it decreases long COVID. It might be the only thing that actually decreases long COVID. So metformin, something that you're going to probably hear more about. Another article I read was talking about the fact that there was this CDC Grand Rounds presentation where there was a discussion of the test negative design. This was the type of study that was used for many different vaccines, the one that the acting CDC director blocked from being published in the CDCM, and then it ended up getting published in the JAMA Journal anyway. What I read about in Stat, I think, was that what was happening at this Grand Rounds presentation, where there was a debate, they're trying to actually make a scientific debate when there actually is none. Test negative study designs, everyone knows their value, everyone knows their limitations. It's sort of the best way to study vaccine efficacy that we have. Yes, it has some caveats, but it's not something that completely gives you a biologically implausible answer. So I don't know what this as the op-ed stated, this is a manufactured scientific debate based on ideology because people don't like the results that show efficacy and safety of certain vaccines, so they oppose it. West Nile virus. Right now in the country, there are 14 states that have West Nile cases that have been reported. 51 people are diagnosed in the United States. That's an underestimate. Most people who get West Nile have no symptoms at all or flu-like symptoms, so they're probably not diagnosed. Arizona seems to be the hardest hit state, but other states will probably likely have increases as well. And right now, this total that we're seeing here in July of 2026 is the highest total that we've seen since 2004. So there is an acceleration of transmission of West Nile virus going on. And remember, West Nile is spread via mosquitoes. And speaking of vector-borne diseases, there was an article talking about what was going on in Illinois in terms of tick-borne disease. And they talk about the seasonality. Yes, there's a peak in tick-borne disease in the summer months, June, July, but they actually had tick-borne disease year-round in Illinois, except with the exception of babesiosis. So when something is seasonal, that doesn't mean it goes to zero. It means it becomes lower, less common during certain months versus other months. It doesn't completely vanish. So I think that's important to think about with tick-borne disease. Foodborne disease now, moving on to it. I read today that the New York Yankees have some cases of what they're calling food poisoning requiring intravenous fluids. Certain players, and I'm not a major baseball fan, but McMahon and Jones both have what's called food poisoning. I don't know if that's food poisoning or that's norovirus. Oftentimes people use food poisoning as a kind of a colloquial catch-all term when it's really about GI illnesses, GI viruses that pass from person to person. Another foodborne illness is salmonella. There is an outbreak in Europe with 49 people hospitalized related to packaged noodles or flavored noodle mixes, where salmonella has found its way into that, especially because they had like chicken flavoring. So remember, poultry all have salmonella. Maybe that's the route. We'll have to see. Artificial intelligence. I've been talking a lot about the promise of artificial intelligence. There was an article that I read talking about the way artificial intelligence is going to revolutionize infection prevention. So what's infection prevention? It's what goes on in hospitals to prevent patient A from infecting patient B and also infecting staff or staff infecting patients. It's the gowns and gloves that you use. It's the cleaning. It's detecting transmission of pathogens like MRSA, C. diff. So AI is going to increasingly change or augment what the standard infection control infection practitioner's life is. And I think it's going to be really cool. There's awesome stuff going on with whole genome sequencing using AI and machine learning to find outbreaks in hospitals that wouldn't even be identified as outbreaks using the old way. So I think this is going to make hospitals safer, and we're going to learn a lot more about transmission of pathogens in hospitals. Altona, the diagnostic company, got a multiplex sexually transmitted infection panel approved. So by multiplex, I mean it can test for like 7 different things. One of the things that it can test for is Mycoplasma genitalium, which is an STI that is often hard to diagnose late, can sometimes be a little tricky to treat, but it's way underdiagnosed and hard to do. This type of molecular test that's part of a panel is a really good way to do this. So someone has STI symptoms, you test for all 7 of these things rather than testing one, and then eventually figuring out the diagnosis. I think that's the gold standard, is to use syndromic testing with multiplex, multiple different targets, so you can figure out what's making someone sick. Hopefully, this test gets approved in the United States as well. RSV vaccination. Females prefer, or pregnant women prefer, to be vaccinated when they're pregnant rather than to give them their newborn the monoclonal antibody shots that are available. 70% prefer being vaccinated in pregnancy. I think that's a little bit surprising to me, because I think the data actually shows the monoclonal antibody is better. It's easier to schedule, but maybe people don't want to put a needle into a little baby. I understand that versus getting vaccinated as a pregnant woman. And they're both efficacious, but it's interesting how those patient preferences are kind of playing out. Last thing, I want to mention something about COVID again, and I wanted to end on it because I think it's an important point. So there was a study looking at social media reactions to the rollout of the COVID vaccine. So this occurred in December of 2020, and they saw different types of emotions: joy, diminished fear, and anger. The fact that anger occurred when people saw the rollout of the COVID vaccine, you think of that, if you have, that's the emotion that you felt, what are the underlying premises you must hold? Because obviously our emotions come from the premises that we hold. I think they can only be nihilistic, anti-human, really irrational premises. If you feel anger when a life-saving technological marvel is made at warp speed, literally warp speed, and had the ability to change the course of the pandemic, if that makes you angry, there's something wrong with your thinking. And that's what I'm going to end with.